Hello guys, welcome back and I hope you all are doing absolutely fine. So in this video we'll be continuing the part 2 of the gynecology important definitions and pointers series and important 2 markers for your exam revision. So I hope this video helps you all out, and please remember that we have kept a target of 1000 views and 100 likes. So please help me achieve that as well. Thank you. And as soon as it is achieved, I'll be uploading these notes of the same on my Telegram channel. So yeah, please help me achieve the target. So we'll continue with the part 2 of this series with our next definition, which is choledosynthesis. It is the transvaginal it is a transvaginal aspiration of peritoneal fluid from cool-day sac. This technique is used for identification of pelvic inflammatory disease and hemoperitoneum. Hormones secreted by ovary. They include estrogen, progesterone, androgens, and inhibin. Remember that the androgens and inhibin are a rare type of hormones which are generally missed out while remembering. So please remember it. Causes of primary amenorrhea. Amenorrhea is absence of menses. Hypogonadotrophic hypogonadism, delayed puberty, dysfunctional of pituitary gland and hypothalamus, hypergonadotrophic hypogonadism, primary ovarian failure, enzyme deficiency, galactosemia, abnormal chromosomal pattern, Turner's syndrome, androgen insensitivity syndrome, defect in development of genital tract, imperforate hymen, complete absence of vagina, systemic illness, anemia, and malnutrition. Causes of male infertility. Congenital causes are undescended testes, Cartagener's syndrome. Thermal factors include varicocele, hydrocele, infection like mump orchitis, bronchiectasis, and genetic syndromes such as Klinefelter syndrome. Endocrine reasons could be gonadotrophin deficiency, thyroid dysfunction, and iatrogenic causes are radiation and cytotoxic drugs. Complications of benign ovarian tumors: intercystic hemorrhage, infection, rupture, malignancy. Complication of IUCDs: immediate complications are cramp-like pain, syncopal attack, which is sudden loss of consciousness and muscle tone, perforation. Remote, there is pain, abnormal menstrual bleeding, pelvic infection, and perforation of uterus. Contents of OC pill. The OC pills include progestins like levonorgestrel and desogestrel, estrogen, ethinyl estradiol, and menstranol. Clinical features of pelvic abscess. Symptoms: high spiking fever, pain in lower abdomen, difficulty to retention of urine, rectal tenesmus. Signs: general signs are face is flushed with anxious look, increased pulse rate, which is tachycardia. Per abdomen, there is tenderness in the lower abdomen, mass is felt in suprapelvic region, and per vaginum, there is vagina is hot and tender, uterus is pushed anteriorly. Barrier method of contraceptive. They are mechanical, which is the male condom, female condom, diaphragm, cervical cap, and chemical, creams, jellies, foam tablets. It prevents the sperm deposition in the vagina. Ideal contraceptive. When is an contraceptive termed to be ideal? It should be easily available. It should be effective for preventing STD. It should not have any side effects. It should be cheap. It should be reversible. It should not interfere with sexual act. IVF. It is an in vitro fertilization, which is also called test tube baby program. In this kind of fertilization, fusion of gamete takes place outside the female body. The technique used in IVF are zygote interfallopian transfer, ZIFT, and gamete intrafallopian transfer, which is GIFT, gift. Pyometra. It is a collection of pus in the uterine cavity. It is due to occlusion of cervical canal, sources of pus formation and infection. Gynec indications for DNC, which is dilatation and curettage. Diagnostically, DUB, endometrial tuberculosis, endometrial carcinoma, and infertility. Therapeutically, DUB, incomplete abortion, endometrial polyp, removal of IUD, and combined DUB and endometrial polyp. Endometriosis. It is a condition in which growth of endometrial tissue takes place outside the uterus. Common sites of endometriosis are ovary, sigmoid colon, pouch of Douglas, and rectovaginal septum. Causes of endometriosis: environmental toxins, family history of endometriosis, molecular defect, and delayed childbearing. Investigation of CA cervix: chest X-ray, CT scan and MRI, lymphangiography, ultrasonography, and cystoscopy and proctoscopy. Clinical features of CA cervix: irregular or continual vaginal bleeding, offensive vaginal discharge, pelvic pain, leg edema, frequency of micturition, and dysuria or hematuria. Investigations of PCOS: it can be investigated by sonography, insulin resistance checking, laparoscopy, and serum level when LH and FSH ratio is more than 2:1. Total testosterone is more than 150 nanogram per deciliter. Causes of vagicovaginal fistula: trauma, malignancy, radiation, and vaginal tuberculosis. Mode of action of OC pills: inhibition of ovulation, producing static endometrial hyperplasia, alteration of character of cervical mucus, interferes with motility and secretion of fallopian tubes. Heron syndrome: it is a clinical feature of polycystic ovarian syndrome. It is characterized by hyperandrogenism, insulin resistance, and acanthosis nigricans, which form the word hair-on. Asherman syndrome or uterine synechiae: it is formation of adhesion in uterine cavity. It occurs in women who have dilatation and curettage procedure. Hysterosalpingography shows honeycomb appearance. Adenomyosis: it is an abnormal condition in which growth of endometrium into myometrium takes place. It occurs between 40 to 50 years and symptoms include pelvic pain, profuse menses, menorrhagia, and suprapubic swelling. Mammography: this is also separately asked for 5 markers. It is an X-ray of the breast. It is used to detect and diagnostic of breast cancer. The diagnostic accuracy is about 90 to 95%. It is a non-invasive procedure. In mammography, minimum hazards of radiation takes place. Indication of mammography: patient, physician, identified breast lump, focal breast pain, suspected breast abscess, spontaneous nipple discharge, and nipple changes which takes place like eversion of nipples. So guys, this was the part 2 of the surgery of the gynecology important pointers and definition series and previous year's 2 marker. I hope this video helps you out to revise your gynec papers portion, and please do like, share and subscribe it with your friends. Share it with your friends and help them as well. I'll see you in the next video. Until then, goodbye and take care. Thank you.